This adjustment is a supine covered thumb distal clavicle for an I to S glide restriction of the AC joint. We'll start by showing, this adjustment is very similar to the palpation. We'll start by showing this true covered thumb presentation, and then I'm going to show you a modification where we use a hypothenar instead of a covered thumb. Sometimes our patients, if they have a little bit of a tenderness on that contact on that distal clavicle with a covered thumb, using a hypothenar can be a little bit more comfortable for them. So we'll start here. We'll start by grabbing our patient's arm, and then we're going to put it here between our legs as we've done for our GH adjustments. What I'll have you do is you'll palpate distally until we find that distal clavicle, and you'll establish a thumb contact. Then you're going to take your other hand and you're going to cover over that thumb contact. You'll apply pressure here to hold that clavicle still. You're not impulsing, but you're applying pressure to hold that clavicle while you actually distract with your leg. So there's an impulse with the leg here as we're holding the clavicle still. Now, I can tell that because she's thin, we're going to hit that bone, that clavicle pretty easily here, and it's going to be uncomfortable. So I'm going to use a hypothenar contact, and I'm just going to add a little bit of a pressure on my own hypothenar here, so that I've got a little bit more. I've got a little bit more meat here. I've got a little bit more of a soft contact on that distal clavicle. It's a lot more comfortable for the patient here. And then I'm going to add that pressure, hold that clavicle still while I distract with the legs here. And that, remember, that distraction is pulling that acromion then away from that distal clavicle. So this adjustment was a supine covered thumb distal clavicle for an I to S glide restriction of the AC joint.